Good afternoon and welcome to today's press conference. I'm Mia Rabson from the Canadian Press and I will be moderating today. We have with us Health Minister Jean-Yves Duclos, the Chief Public Health Officer of Canada, Dr. Theresa Tam, the Deputy Chief Public Health Officer of Canada, Dr. Howard Njoo. This is not a COVID briefing, just to be clear. And I believe you have some opening statements and then we'll go for questions. We'll start with questions in the room and then we'll move online. So go ahead, Minister.
Merci et bonjour à tous et à toutes. Merci de me permettre de m'adresser à vous aujourd'hui avec mes collègues, la Dr Tam et le Dr Njoo. Il y a aussi Matthew Jones qui est présent pour répondre à certaines des questions plus techniques. Ce matin ou cet après-midi, nous aimerions faire une mise à jour sur les conséquences des feux de forêt sur la santé des Canadiens et des Canadiennes. L'état de santé de notre population est intimement relié à l'état de santé de notre environnement. Cette année, les Canadiennes et les Canadiens ont été confrontés à des répercussions sans précédent des feux de forêt. Et le plus préoccupant, c'est que le pic de la saison des feux de forêt ne sera probablement atteint que dans plusieurs semaines. Ces événements ont déjà une incidence réelle sur notre santé physique et mentale. Présentement, un total de 423 feux de forêt sont actifs en Colombie-Britannique, au Nunavut, en Alberta, en Ontario, au Québec et en Nouvelle-Écosse, dont la moitié sont hors de contrôle. Depuis le début de l'année, nous estimons que près de 6 millions d'hectares ont déjà brûlé au pays et nous ne sommes qu'en juin. Cela est 18 fois plus que la moyenne sur 10 ans à cette date. Nos pensées sont évidemment avec toutes les personnes et toutes les familles qui ont été déplacées. Plus de 100 000 personnes ont dû quitter leur maison cette année en raison des feux de forêt et plusieurs personnes attendent toujours de rentrer chez elles, y compris des membres des Premières Nations. People across the country are feeling the effects of these wildfires. Smoke from wildfires contains harmful pollutants, and even low levels can impact our health. Smoke from wildfires has been found to be a leading source of air pollution health impacts in Canada, and it can travel hundreds of kilometers, affecting the air quality in communities far from the fire zone. People in Western Canada and in some Indigenous communities have known this all too well for many years. Others may be experiencing it for the first time. It is therefore important that we all understand how to protect ourselves in the next few weeks. One helpful tool is to use the Air Quality Health Index, or AQHI. The Air Quality Health Index is continually updated and reports air quality in many locations on a scale of 1 to 10 plus, a rating of 10 plus like we had in Ottawa 2 weeks ago being considered very high risk. If the AQHI is high, or if you see and smell smoke in your area, you should consider staying indoors and avoiding strenuous outdoor activities, keep doors and windows closed, consider installing a HEPA filter system, or use a portable air purifier to improve indoor air quality. We should be particularly mindful of young children, expectant mothers, seniors, and people with heart and lung conditions. These are some of the groups at greatest risk for serious health effects from poor air quality. Many communities in affected areas have opened clean air shelters in public facilities to ensure that everyone has access to clean, cool air. If we must go outdoors when the AQHI is high, we should limit the time and consider wearing a mask to help filter harmful particles. The Government of Canada will also continue to collaborate with provinces and territories to ensure they have the resources they need to address this crisis. So far, we have responded to requests for federal assistance from the provinces of Alberta, Nova Scotia, and Quebec. For example, the Public Health Agency of Canada has supplied Alberta with essential items like cots, blankets, ward boxes, and disposable sheets. PHAC is also working with provinces and territories, as well as community organizations such as the Northwest Company, to make N95 masks available to vulnerable populations. We continue to offer support to community organizations with national reach, such as the Canadian Interagency Forest Fire Centre, to ensure that masks are available to those who need them most. Where we can, we will pre-position supplies in anticipation of future needs. To help boost air quality monitoring capacity during the emergency response, Health Canada is also providing air quality monitors. Thus far, we have sent 6 air quality monitors to Nova Scotia and 24 to Quebec. We have also provided 2 monitors to the Yukon, with additional sensors to follow later this month. These will be used by long-term care facilities and hospitals to protect patients and test both indoor and outdoor air quality. Finally, following a request from the British Columbia First Nations Health Authority, Health Canada is procuring an additional 25 indoor air quality monitors, which will be deployed in the next few weeks. Permettez-moi en terminant de remercier les membres des Forces armées canadiennes qui sont à pied d'œuvre pour stabiliser la situation et apporter leur soutien en Alberta, en Nouvelle-Écosse et au Québec. Nous sommes très reconnaissants aussi aux pompiers qui travaillent jour et nuit pour protéger nos communautés, sans oublier les bénévoles et toutes celles et tous ceux qui travaillent sur le terrain pour aider les personnes et les communautés affectées. Si vous ou quelqu'un que vous connaissez avait besoin d'aide pendant ces temps difficiles, je vous encourage à visiter le site Mieux-être Canada qui offre du soutien gratuit et confidentiel en matière de santé mentale et de toxicomanie. Ce service est offert 24 heures sur 24, 7 jours sur 7. Je vais maintenant céder la parole à la Dr Tam et au Dr Njoo. Merci. Thank you.
Bonjour à toutes et à tous. Canada is experiencing more intense and frequent weather events associated with climate change. Many regions and communities across the country are witnessing this firsthand as wildfires continue to burn across the country. As observed over the last few weeks, wildfire smoke can impact air quality over vast distances, affecting the respiratory health of people who live hundreds or even thousands of kilometers away. Wildfire smoke is made up of small particles and gases. It is the fine particles not visible to the human eye that carries the greatest risk to human health, as it can be inhaled deep into the lungs and cause inflammation and irritation. Some of the other components of smoke can also irritate the eyes, nose, throat, and lungs. There is growing evidence that exposure to seasonal wildfire smoke may have longer-lasting impacts on our health. Indigenous communities in northern and remote regions are disproportionately affected by emergency events, including floods and wildfires. This year, many First Nations have been forced to evacuate from their homes and ancestral lands due to wildland fire activity. No matter where you live in Canada, you can be affected by wildfire smoke. In addition, wildfires often occur during extreme summer heat. Each of these events can pose a significant threat to our health, especially when combined. To reduce the risk to our health, we must take steps to be prepared and be proactive. By using a multi-layered approach, including evaluating your health, you can reduce your risk. Be prepared includes being ready to take care of yourself and your family, including pets, should you be affected by wildfires or smoke. For example, ensure you have a sufficient supply of necessary medications and maintain your home ventilation system and use a clean, good quality air filter and find out where your local clean air center is. Use the WeatherCan app, listen for local air quality statements. Check the information from local health authorities to stay informed about air quality, including the Air Quality Health Index, or AQHI, in your area or an area where you may be traveling. If the air quality is poor, or if you see or smell smoke, you can reduce smoke exposure by staying inside with doors and windows closed, but keep cool. Being too hot poses more risk than breathing smoke for most people. If you do not have air conditioning and it is too warm to stay inside with the windows closed, seek out a local cooling or clean airspace. Consider minimizing your exposure by limiting outdoor activities if the air quality is poor, especially if you're at higher risk of smoke-related health impacts. Consider rescheduling these activities during better weather conditions. If you must spend time outside, consider using a well-fitted respirator-type mask to reduce exposure to the fine particles from wildfire smoke. No one is immune from the health impacts of wildfire smoke and extreme heat, but some people and communities are at greater risk for severe outcomes and should take extra precautions. These include seniors, pregnant individuals, infants and young children, people with asthma and other pre-existing chronic health conditions, outdoor workers, and those engaged in strenuous outdoor activities, including firefighters and emergency responders. Watch for the more common symptoms of smoke exposure, which include irritation of the throat, nose, and eyes, cough, wheezing, and headaches. If you have any of these symptoms, seek clean air either within your home or in a public space. If it is also hot, then watch for the symptoms of heat illness, which includes headaches, muscle cramps, thirst, dark urine, nausea or vomiting, or even sleepiness. Make sure to stay cool and well hydrated. If you need to make a choice, then staying cool is more important than having clean air because heat illness is more serious. Seek immediate medical attention if you develop severe symptoms, such as difficulties breathing, chest pains, high body temperature, hot, red, and dry skin, dizziness, or confusion. And remember to look out for each other. Take the time to check on neighbors, friends, and older family members. By staying informed and being prepared, we will get through this fire season together safely. Thank you. Merci. Miigwech.
Bonjour à toutes et à tous. Nous observons au Canada une hausse de l'intensité et de la fréquence des phénomènes météorologiques en raison des changements climatiques. À travers le pays, de nombreuses régions et collectivités sont à même de la constater alors que les feux de forêt se poursuivent. Comme nous l'avons remarqué ces dernières semaines, la fumée des feux de forêt peut faire baisser la qualité de l'air sur de grandes distances et nuire à la santé respiratoire des personnes qui vivent à des centaines, voire des milliers de kilomètres des feux. La fumée des feux de forêt est composée des particules fines et de gaz. Ce sont les particules fines, invisibles à l'œil nu, qui sont les plus nocives pour la santé humaine, car elles peuvent être inhalées profondément dans les poumons et entraîner de l'inflammation et de l'irritation. D'autres composantes de la fumée peuvent aussi irriter les yeux, le nez, la gorge et les poumons. Il y a de plus en plus de données qui indiquent que l'exposition à la fumée de feux de forêt saisonniers peut avoir des incidences à long terme sur la santé. Les communautés autochtones dans les régions nordiques et éloignées sont plus sérieusement affectées par les situations d'urgence, comme des inondations et des feux de forêt. Beaucoup de membres des Premières Nations ont dû évacuer leurs maisons et leurs terres ancestrales en raison de l'ampleur des incendies de végétation cette année. La fumée de feux de forêt peut vous affecter, peu importe où vous habitez au pays. De plus, le feu de forêt se produit souvent pendant les chaleurs estivales extrêmes. Chacun de ces phénomènes peut avoir des effets importants sur notre santé, surtout s'ils sont combinés. Afin de réduire le risque pour notre santé, nous devons prendre les mesures nécessaires pour nous préparer et agir de manière proactive. Vous pouvez réduire votre risque en utilisant plusieurs stratégies en même temps, dont une évaluation de votre santé. Se préparer inclut d'être prêt à prendre soin de vous-même et de votre famille, y compris de vos animaux de compagnie, dans l'éventualité où vous seriez affecté par des feux de forêt ou de la fumée. À titre d'exemple, vérifiez que vous avez une quantité suffisante de médicaments nécessaires et entretenez le système de ventilation de votre résidence ou domicile. Utilisez un filtre à air propre de bonne qualité et déterminez à l'avance où se trouve un endroit avec de l'air purifié près de vous. Pour consulter de manière proactive les prévisions sur la qualité de l'air dans votre région ou à votre destination, utilisez l'application MétéoCan. Écoutez les bulletins spéciaux sur la qualité de l'air ou consultez les informations des autorités locales de santé publique afin d'obtenir les informations sur la qualité de l'air et la cote Air Santé. Si la qualité de l'air est mauvaise ou si vous voyez ou sentez de la fumée, Vous pouvez réduire l'exposition à la fumée en restant à l'intérieur et en gardant les portes ainsi que les fenêtres fermées. Mais assurez-vous aussi de rester au frais. Pour la plupart des gens, la chaleur est plus dangereuse que l'inhalation de la fumée. Si vous n'avez pas de climatiseur et qu'il fait trop chaud pour rester à l'intérieur quand les fenêtres sont fermées, déplacez-vous dans un endroit avec de l'air purifié près de vous. Envisagez de réduire votre exposition à la fumée au minimum en limitant vos activités extérieures quand la qualité de l'air est mauvaise, surtout si vous avez un risque accru de complications de vos problèmes de santé. Songez à remettre ces activités à un moment où les conditions météorologiques seront meilleures. Si vous devez passer du temps dehors, vous pouvez utiliser un masque respiratoire bien ajusté pour réduire votre exposition aux particules fines de la fumée de feux de forêt. Personne n'est à l'abri des effets sur la santé de la fumée de feux de forêt et de la chaleur accablante, mais certaines personnes et certaines communautés sont plus à risque de conséquences sérieuses et devraient donc prendre des précautions supplémentaires. Les personnes à plus haut risque incluent les aînés, les personnes enceintes, les jeunes enfants, incluant les bébés, les personnes vivant avec l'asthme ou d'autres problèmes de santé chroniques préexistants, les gens qui travaillent à l'extérieur et les personnes qui font des activités extérieures exigeantes, comme les pompiers et les intervenants d'urgence. Surveillez les symptômes d'exposition à la fumée les plus fréquents, notamment une irritation de la gorge, du nez et des yeux, la toux, la respiration sifflante et des maux de tête. Si vous avez n'importe lequel de ces symptômes, cherchez un endroit où la qualité de l'air est meilleure, soit chez vous ou dans un lieu public. S'il fait aussi chaud, surveillez également les symptômes de maladies liées à la chaleur, qui incluent les maux de tête, les crampes musculaires, la soif, l'urine foncée, les nausées et vomissements et la somnolence. Restez au frais et hydratez-vous. Si vous avez à choisir, restez au frais, l'emporte sur une bonne qualité de l'air parce que les maladies liées à la chaleur sont plus sérieuses que celles liées à la fumée. Consultez immédiatement un médecin si vous développez des symptômes plus graves comme des difficultés respiratoires, des douleurs à la poitrine, une température corporelle élevée, la peau rouge, chaude et sèche, des étourdissements ou de la confusion. Finalement, il est important d'offrir de l'aide aux personnes qui pourraient en avoir besoin. Prenez le temps de vérifier que vos voisins, vos amis et vos parents âgés vont bien. En restant informés et en étant préparés, nous traverserons ensemble cette saison des feux en toute sécurité. Merci. Thank you. Miigwech.
Thank you. We'll start with questions in the room. We'll have one question, one follow, and then we will move online. If you are on Zoom and you would like to ask a question, please use the raise hand function, and we'll start with Kevin Gallagher from CTV News.
So this question is certainly for Minister Duclos, but Dr. Tam and Dr. Njoo, it might also be pertinent for you as well. During these times of very acute and poor air quality that's being caused by these wildfires, there's also often a correlation in an increase in hospital admissions, increase in people going to the emergency room. I mean, this is all coinciding with the Canadian Medical Association Journal putting out an article today saying that emergency rooms are in crisis, staffing shortages, that this is something that would be prolonged and for quite some time. So is there a concern that already squeezed emergency rooms will be in even worse shape given the outlook for wildfire smoke affecting people's health across the country?
Well, thank you for the question, and I'll turn to Dr. Tam in a moment. That is correct. Now, our emergency departments are already quite burdened. We know the lasting impact of COVID-19 on healthcare workers in particular, which has led many of them to leave or to retire early. So the situation is obviously continuing. Although there are signs of improvement in some parts of Canada, overall, it is still an issue of great concern both to workers and to patients. Now, when it comes to what Health Canada and PIAC in particular have been able to see given the recent occurrence of the wildfires, I'll turn to Dr. Tam.
Yes, I'll speak more generally to the impact of wildfire smoke. So wildfire smoke consists of a collection of different gases and particles. So in our remarks, we talked about these fine particles, or sometimes you see the designation PM 2.5. These are small, tiny things that you can potentially then inhale into your lungs and cause irritation and inflammation. And there's certainly correlation between these fine particle inhalation and lung problems and airway problems such as asthma, chronic obstructive airways disease exacerbations, bronchitis and pneumonia, so infections as well. Although the data is still somewhat mixed, there could also be impact on your cardiovascular system. And so that needs to be further studied. What is even more interesting is if these wildfires become more frequent and of longer duration and repeated every year, for instance, you have to sort of look at the longer term impacts over multiple exposures. And that we know less about. Although there have been studies in certain populations, such as firefighters who are more exposed to wildfire smoke, that would suggest that there could be longer-term impacts. I think those need to be studied. Of course, any impact, such as asthma going up, will have some impact on emergency rooms and the healthcare system.
Dr. Njoo, maybe the only additional thing I would add is that certainly we have seen from past experience that there will be an impact, let's say, for example, visits to emergency departments, but I think the average individual can certainly take steps to prepare and hopefully maybe avoid having to see a doctor or go to the emergency department. For example, if you're prone to asthma, it's a good idea to be have a good supply of, let's say, your inhalers, your ventilators, make sure that they're up to date on expired and so on. And so also to take a look at what activities might have planned if obviously the air condition, the air quality is not looking good for a certain day, then maybe you might look at foregoing some of the outdoor activities you might normally do, but that depends on your own evaluation of your health. So I think there's a lot that the average person can also do to look at their own situation, see also what they could be doing for their family and friends, and then hopefully in that way prevent any visits to the emergency department.
My follow-up will just be for you, Minister. What can be done about the shortage of doctors that's affecting the capacity of emergency rooms? And certainly if doctors are saying that this is a crisis and it's now for the foreseeable future, is what strategies can be used to perhaps give more money or make sure provinces spend dedicated money on training, new staff to meet these long-term and short-term capacity issues?
Great question, and I'll answer in three different pieces. The first one dates back to February the 7th, when we had the Prime Minister making an offer to provinces and territories of the order of an additional $200 billion over the next 10 years. The second thing is that out of the shared areas of priorities that we were able to agree on, a key one was about health workers. And we all agreed to the importance of retaining them, which is absolutely key to everything we do around supporting the health workforce. So retaining them means providing the mental and physical support that they need to pursue their career and staying in their career. Also, obviously, training more because our population of health workers is aging rapidly, as a population overall is aging rapidly. And finally, recognizing more quickly and more efficiently the credentials of those that have been trained in other places in Canada or outside of Canada. On these three different pieces, the retention, the recruitment, and the recognition of the credentials of the health workers, we're making good progress. I will just point to the fact that just a week ago, Nova Scotia and PEI followed earlier, predated earlier by other provinces like Ontario and British Columbia, have been doing great things, in particular on retention, recruitment, but also on the recognition of foreign credentials. Now in Nova Scotia, if you are a nurse being trained outside of Canada, it's almost immediate that your credentials will be recognized. And this is also happening in other parts of the country for physicians and other health workers. In Atlantic Canada, we are now seeing an Atlantic Registry of Physicians, which facilitates the movements of physicians from one province to another in areas, in times when there are crises and people, health workers, need to be moving from one place to another. So it's obviously something critical. It's also clearly a significant challenge in a federation where the federal government doesn't have the jurisdiction or the power to make those changes. But it's a great source of progress and hope to see provinces and territories moving in those directions.
Thank you. We'll go to Louis Blouin from Radio-Canada.
Vous avez dit, M. Duclos, que le pic, le sommet de la saison des feux n'est pas atteint. Pouvez-vous nous donner une idée, peut-être, de la période qui sera la plus sévère cet été? Quand faut-il s'y attendre? Est-ce qu'il y a une période qui vous semble plus critique? Juste nous aider à comprendre un petit peu la courbe, là, ça en va comment pour les prochaines semaines?
Merci. Ce que les gens d'Environnement Canada nous disent, c'est que le pic est généralement au mois d'août, ou au début du mois de juillet, pardon, et au début du mois d'août, quand on a une combinaison de deux choses, un temps sec et deux, un temps chaud. Évidemment, ce sont des moments juillet et début août, où en plus on a connu dans les semaines qui ont précédé des feux qui n'ont toujours pas été contrôlés. C'est ce qu'on observe présentement, c'est qu'il y a des feux d'une telle intensité, d'une telle ampleur que l'on sait qu'ils vont continuer au cours des prochaines semaines et alimenter d'autres feux en juillet et en août. Donc c'est à ce moment-là de l'année que traditionnellement l'intensité des feux de forêt est la plus problématique en matière d'impact sur l'environnement, mais aussi dans ce cas-ci en matière d'impact sur la santé des gens.
Docteur Njoo, vous dites il faut trouver, s'il y a de la fumée, etc., un endroit où l'air est purifié, etc. C'est pas tout le monde qui a un système de purification d'air à la maison, qui a un système de ventilation à la maison. Vous recommandez quoi? Est-ce que les gens devraient quitter leur domicile, changer de ville, se déplacer? Si pour des personnes, j'entends, qui sont vulnérables du point de vue de la santé, qu'est-ce qu'il faut faire si on n'est pas équipé en conséquence?
De faire attention à c'est quoi la qualité de l'air de chaque jour, mais c'est aussi important de garder au frais, parce que s'il y a un choix à prendre entre rester dehors il fait chaud et rester à l'intérieur si on n'a pas peut-être un bon système de climatisation, c'est mieux de rester au frais, parce que les maladies liées à la chaleur, c'est plus grave. Je pense que c'est très important d'être au courant avec les bulletins spéciaux des autorités à l'échelle locale, parce qu'il y a plusieurs endroits, je pense, dans chaque unité, peut-être avec l'air purifié. Je pense que les autorités à l'échelle locale ils sont en mesure d'avoir certains endroits, parce qu'ils savent que beaucoup de personnes peut-être qui ne sont pas capables de rester chez eux. Donc, je pense que c'est très important de rester au courant, mais je pense aussi important de sensibiliser la population générale. C'est quoi le comité en français, le CAS, le Code d'air santé aussi, c'est quoi les niveaux? Et c'est comme la météo maintenant, peut-être chaque jour, si on regarde, est-ce qu'il va pleuvoir? Peut-être aussi, il faut regarder c'est quoi la CAS pour la journée, peut-être ajuster les activités.
Kate McKenna, CBC.
Hey there. I was just wondering if you have any statistics on how many people are getting sick, where those people are, how sick are they getting? I hear you on the long-term effects, but what is the situation on the ground now?
I'll start with high-level numbers, which have been computed by Health Canada over the last decade. So between 2013 and 2018, it's estimated that bad air quality has caused the premature deaths of about 15,000 people, amounting to 6% of GDP, which is obviously considerable. Out of these deaths and impact on the economy, about a sixth is due to wildfires. So translating these numbers, it would be during an average year between 2013 and 2018, it would be about 2,500 people who would have died of the long-term consequences of bad air quality because of wildfires, and that's an economic cost of about 1% of GDP, which is $20 billion. So these are average numbers dating a few years back. Now we know that because Canada is warming at twice the rate of the rest of the world because of what we're seeing this year, which is that to date there have been 18 times more forests being burnt than what we have seen over the recent years. So we expect, unfortunately, both the short-term and the longer-term consequences of bad air quality due to wildfires to be even larger than the numbers I just gave you. Now, on what we already know until now, based on the current season, I would turn to Dr. Tam.
Yes, so there's no real-time reporting from local jurisdictions up to, say, the Public Health Agency of Health Canada on the day-to-day. It's not like COVID, you know, we got a system going and, you know, everyone is tracking numbers every day. That isn't the case necessarily with asthma or COPD. But I think it is important, certainly at the local level, to observe the trends. You know, I think Minister Duclos has been a big supporter of, you know, making sure we get data in more real time in the health system. And that might help in the future, but no, we don't track, it's not like a reportable disease that we track on in real time.
Thank you. And just as a follow-up, Minister, you mentioned that the government has already procured more air quality monitors, but you also mentioned that the peak is yet to come. So I'm wondering if there are any thoughts in terms of preemptive procurement to deal with what might be coming.
Indeed, Health Canada and PHAC are pre-positioning some of those materials. As you mentioned, we have been sending air quality monitors. We've been sending masks and other pieces of equipment that people can use either in their homes or in long-term care and hospital settings. And we are doing this, as you said, preemptively, in advance of the season that we know almost for sure will be quite difficult for many communities in Canada. And as we do that, and as Dr. Tam also mentioned, we are obviously working with closely and listening to carefully the health workers and the leaders, the health leaders that we are hoping to continue supporting in the next few weeks.
Thank you. I'm going to take the moderator's privilege to ask a couple questions from this chair. Dr. Tam, you mentioned that it's not a reportable disease like COVID was or other public health. Should it be? Should air quality or respiratory problems or other issues connected to air quality, should that become a reportable issue so that we can track it better?
Well, I think if we move the health system data to a modern era where there's no increase in burden, but it's in an efficient way, be able to track all sorts of health indicators over time, that could be helpful. Certainly, I think much of this data may be made available at the local level. So at the national level, in past years, there hasn't been as much attention because a lot of the wildfires were in the West. So I heard from my colleagues, the chief medical officers from, say, the Atlantic or Nova Scotia, hasn't had as much experience. And so I think in preparation for what might be coming in the future, looking at systems and their ability to report trends, whether it's emergency rooms, others, could indeed be quite helpful. But that's not the reality right now.
And sort of further to that, has the national emergency stockpile been adjusted, or should it be adjusted to account for the changing needs from climate-related things like wildfires?
I think the National Emergency Strategic Stockpile, and particularly coming out of the pandemic, should have its scope and mandate confirmed. And I think part of that will include an assessment or on forecasting of the types of health risks that could hit the Canadian population. But for sure, we have quite an extensive social service supply, cots, blankets, and other supportive equipment. And we, of course, have quite a lot of masks actually stockpiled. And these, we've now learned to be able to use them in a more flexible way. So I think right now we expect the supplies to be okay on the mask front, but we will have to take into account, well, if it's not just viruses, if there's other health risks that may benefit, then what will be appropriate. But of course, much of the mask use in the population is by the province and territory, so we do have to sort of coordinate with them. We are focused on the populations impacted most and suffering from systemic inequities. So which is why the minister has commented on the fact that the agency is working with certain community organizations and other distribution points that we established during the pandemic to further distribute masks to those who are most in need and may not be able to afford to get them.
I'll give one more call out to questions on the line on Zoom. If you have a question, please use the raise hand function now. And seeing none, that will conclude today's press conference. Thank you.